We have one independent pharmacy in Kingston left. That's it. So we have to be able to say that consolidation of power is not going away. They have the lobbyists, and therefore, how do you, as the people, how do we combat this? How do we ensure that our communities have access to primary care services and understand in the near term we're not going to beat that kind of market economics, right. But there's other ways to win.
Ed, you were talking about being of service to others, and that kind of reminded me of kind of the opposite viewpoint, the business viewpoint. I read something where there was a discussion of what industries Amazon is likely to take on next.
Oh yeah.
Because their approach, as you know, is huge volume, control of market, fairly low margin, and just grow it and grow it and grow it. And the first, they listed, I think, 10 industries, and the first 5 and then another 5. And number 1 in the first 5 was the pharmaceutical industry.
Yeah. Yeah.
And I thought, well, that's something I really want to talk to Ed about, because they said that the industry is somehow still disorganized to some degree, and that it's a very high profit, and that it was in the mood for Amazonization, which is a business model, but a completely different one. So I wondered what you thought about that idea.
First of all, great to reconnect with you and be in uptown Kingston, and both of us being from Mount Tremper for so long that we
we'll get to that.
Well, yeah. The first thing is the consolidation of power and control in the hands of few, and we have just seen a massive corporate consolidation. Across the board, Amazon just won, and what you're talking about, they moved into mail order pharmacy in a very large way, and they focus heavy on generic drugs, which are now 83% of all medications. But they're not alone. The consolidation in the healthcare side, where I'm most familiar with, has been relatively brutal. And if you look at any region of the United States, there's only a handful of healthcare systems that control the action in some shape or form. We've seen an enormous consolidation of services and regional hubs. So we have incredible specialty care at this point in time, even more so than before. So that consolidation has occurred, but it's occurred also across the board. If you look at the meat distribution in this country, 3 or 4 companies own and control that. And in pharmacy, it's been very, very strange. I'm on the President's Advisory Committee up at Albany College of Pharmacy, where I went to school. So I have a little bit of an insight coming from academia on how they see it and how they have to make shifts over where is the students going to go and where is the jobs. Right now, pharmacists are in a surplus position as compared to all other health professionals that are in a demand situation. So when you see a Amazon or a commodity like pharmacy, which is about 10.5% of all healthcare services, then you see that it's slowly, a distribution system has slowly been going to the chain drugstores. Mm-hmm. And they've gotten very, very powerful. In our area, CVS, which is now the 8th largest company in America, by the way. CVS,
really?
Yeah.
CVS,
yeah,
okay.
Yeah, the local down to
and Walgreens isn't too far behind, probably.
And CVS has been a little bit more aggressive. They made a decision, like in Hudson Valley, they wanted to be the dominant player. And so they outbid everyone for the New York State contract. They got every HMO contract. And they basically, we see them as brick and mortars.
Yep.
But they have unregulated companies doing a lot of work. And so they go horizontal and vertical. And so they have some of the largest specialty pharmacies. That's where the big money is. That's where the brand drugs are. That's where the injectables are. They have huge mail order pharmacies. Every week there'll be another 2 people saying, I'm sorry, I've been forced by CVS to go mail order. The high schools, the school districts went mail order. So they have allowed themselves to be able to underbid for these contracts, pick up market share, and then they have what's called CVS Caremark, which is a pharmacy benefit manager. They then control the administration of pharmacy benefits.
And what is a PBM? I guess
it's a pharmacy benefit administrator.
Okay, now the article I read said that that's where much of the profits are.
Yeah. The profits are just enormous for the company. So let's just use the CVS Caremark. They're 41% of the overall profits on a quarterly basis for CVS parent company. That's big money.
Huge.
They're unregulated. New York State now the new governor has passed legislation to be one of the more aggressive regulators of PBMs in the United States. We'll see where that goes. We've been up lobbying up at the Capitol. It's a really big deal. So right now they're unregulated, and they control pricing. They tell me what I'm going to charge. They're going to tell me how I'm going to get reimbursed, and it's a take it or leave it.
Okay, so they're in control.
They're in control. They're in total control of the relationships, and their strategy is to improve their market share. That's what the CEO does. And if you're
at 41%, you're doing pretty well.
There you go. So I had a representative from CVS up 2 months ago, and it kind of allowed me to centralize why I want to take and go to a for-profit structure. And she came from Rhode Island. That's their corporate headquarters. Came up, drove there, came all the way up and asked me by name. And I said, yes, I'm Ed. And so I said, well, let me talk to her. And really what it was is, what's your price to go away? But they kind of frame it a little bit of a different way. And so I said to her, look at this pharmacy. The community has worked with me to be, it's beautiful. It's the most beautiful pharmacy you're going to find anywhere. She goes, I've never seen anything like it. I go, did you see any public transportation outside? I go, well, no, there is none. I go, that's a winding road off the thruway that you came. How long do you think it took you to get here? I go, 28 miles, that's how long. Okay, so what you're asking me, and I go, by the way, aren't you having a hard time now retaining pharmacists because you've had a protest and you're now closing hours? I go, okay, so let me get this right. You want to know what the price is for me to go away, close this down, and I can work with you. I can have a nice employment contract. For this community then to lose their pharmacy again after I came back, after they 8 years ago, to open it up after 10 years that they lost it because CVS bought the other gentleman out. For these people with no public transportation to go down this winding road during the wintertime to your pharmacies that you might have shortage of labor. I go, when you drive all the way home, please just really reflect on your career if this is what you want to do. I go, but no, thank you. Now that's the pressure, that's the muscle that occurs so that independent pharmacies just say, I can make it, but I'm making less this year than I made last year. Mm-hmm. And until they finally just get pushed out and then they sell. We have one independent pharmacy in Kingston left. That's it. Yep. So we have to be able to say that consolidation of power is not going away. They have the lobbyists, and therefore, how do you, as the people, how do we combat this? How do we ensure that our communities have access to primary care services and understand in the near term we're not going to beat that kind of market economics, right. But there's other ways to win.
So if you take our neighborhood, Mount Tremper, and you say, well, Phoenicia used to have 20 years ago, who knows how long ago, the Gordons had this.
I think 50 years ago.
50 years ago, yeah. Right? And now I think the place most local people go to is Nikos in Boyceville.
Yeah.
And that's an old-time pharmacy and an old-time family, and they treat you very differently than CVS or Walmart would.
Yes.
Yeah. And what's going to happen? Is that just sort of the remainder of what dying remainder of what used to be the pharmacy model, or is there some way of how do you think we should the people in the system should fight back against this domination?
Well, I've been working on this model for 10 years. So it's been incremental. And I've tried to say, look, I have a few experiences in my career. Let's see what it is that we could do to take this underperforming profession and take then these highly talented professionals, 6 years, doctors of pharmacy, coming out, just filling prescriptions is not enough. So what we came around with is to say that if you create an environment, very important, an environment that's warm and allows people to feel comfortable, and it's colorful, and they then the trust that they already have with a pharmacist gets enhanced. Then what is it that a community pharmacy can do? And we realized that we had to move into being a wellness center. Pharmacy is just one component of it. That's where people needed us to go. Now, the spotlight couldn't be any greater than through COVID. And all of a sudden, our public health responsibility came up. And it was an easy adjustment. We did almost 900 COVID vaccinations, COVID testing. We elevated our integration with substance abuse issues in the community. Every area that we saw that there was a public health challenge, we evolved and took a leadership role. We then also saw that it was a much greater need to do home visits and to work with seniors. So we evolved into that. Then we realized that there was much more of a demand and need for mental health counseling. So we evolved into that and have clinical services on board.
So that's a different way of looking at the creature, organized a different way. So you're talking about COVID. You're talking about substance abuse.
Yeah.
You're talking about alcohol, other elements. You're talking about a community of cases, basically, people with various degrees of access to the health system, who depend on the pharmacist to kind of give them a sense of direction, give them a sense of where they are and who the resources are, which is not exactly what the big companies are.
No, it's everyone has their story, and if you take time to be of service to others, to listen to their stories, it all becomes fun. It evolves, and so our job as health professionals is adapting to the individual needs. Now, we set up patient assistance funds. I have a charitable trust. So if anybody needs mental health counseling, I can help pay for it or have a sliding fee. We are able to help people if they need food. We just did a big drive for the Hunter food storage, and raised food and brought it down to them. It's all through social media that people come. They know the Wellness Center is one that's involved actively with the community. So wherever we are needed, we're able to adapt and even have resources to pick up the charge for people.
I'm interested in that model. As you may know, Ulster County recently brought a motel with something like 80 or 90 units going to be. And it's going to be for homeless people, for people with very low means. And the interesting thing about it is that instead of people going from there to services, medical services, social services, etc. The services will be available there because there's enough of them,
Yes.
so that you can have a little community, and the providers will come to regularly
To the facility.
to that. Is that kind of, that's the social services commissioner said, we ask people not give a list what's wrong with them, but what's the core problem, and they build from there individual situations. It seems to me that that's similar to what you're talking about.
It's very, very similar, and your local wellness center should have a representative that's part of that team, so that it's not just there, but also if they are needing help, that they can go to that wellness center. This model is used in a lot of national health systems, by the way. The British system, the Canadian system. One could argue that their shortage is on the specialty side, but they do a pretty good job on the primary care side. If you look at that, what the social commissioner of social services is talking about, bringing services, it's really a primary care service. It's allowing an individual and to be treated in a holistic way, without an attitude. That's a really key point. Without judgment. Listen to this story. So when I'm dealing with substance abuse individuals, I'll say, look, I don't care if you relapse and you start doing heroin again, all right? I still want you as my patient. Don't lie to me.
Right.
And then we can kind of work through things. Keep them in the system. Don't let them go underground. And it should not be a crime to be poor. And I think that one of the great things of Ulster County, it has a deep history of being novel, trying things different. And I think this would be another one. Is that Ramco that's involved with that? Who's managing that? Is that Ramco a project, or?
It's the county.
The county.
Yeah, the county government is initiated, I think, with federal money.
Yeah, if somebody's a developer to do it.
But it's a public benefit, not a private. Yeah.
I think it's I think that's more and more. And what my particular focus, Getty, has been on the kids.
Uh-huh.
And so I try to make it as fun and friendly for the kids. We have fish tanks for them, art gallery. Every time they come in, they get honey sticks so that they feel engaged at an early age into wellness. Our model is working. It will work really well in Phoenicia now. It's very different than a more traditional retail pharmacy. And so my model is that we got to create an opportunity for that community to own their own wellness center. Uh-huh. And that the community will look at the wellness center like they look at a library. Yeah. It's an essential service, one that we will support, one that we will have an advisory committee to help control. My job is to provide professional management so that we get the economy of scale, make it work, and then the community has this beautiful wellness center for years and years to come, for generation after generation.
Well, that's what you mentioned the National Health Service in Britain, and the Canadian model, and I can't help but contrast the British public adores the National Health Service. They just don't want to see it damaged. So even the conservatives have been brought to owning it and swearing that they don't want to reduce its power in any way. And compare that to the way Americans feel about their system of health services. It doesn't have that same love. It has some portions have love. There's some high points, but it's not a certainly why. Now you say everyone has a story, and what's your story? Tell me. Where I met you. You were, how old were you when you got into the county legislature?
24.
24.
Youngest
a 24-year-old county legislator.
Won by one vote. Your vote, Getty. I hope.
Passionate about health and a real firebrand in the in the Luke Line, Bob Yallum era.
That's right.
And so you've come a long way, and I think locally people know you for well care, for what you did in those years. Tell me a little bit about what's your story?
Well, I've always been an individual that cares about others, and it's been part of who I am, and I came from poverty, so I've had a very a sensitivity. I left the home at 14 and ended up in Orange County. So I had a family give me a shot to go to college, allowed me to finish high school. So I'm very respectful of how one person can make a difference in a person's life. So I just carried that through. I was also the county mental health director for a number of years.
Right.
And then when I got into the HMO industry, it was through a national fellowship at Georgetown Medical School. And so I left being the mental health department. George, I was very happy. We did two beautiful things there, working with family in Woodstock. We got the battered facility down on Pearl Street, and we did the Trudy Resnick Farber Center for Human Development in Ellenville. So I had the opportunity to do this fellowship program, and then I came back to develop our first HMO in the Hudson Valley. It was the Mid-Hudson Health Plan that you were on the board.
Yep.
That was an interesting model because we started with nothing, right, other than an idea. And I was formally trained on how we could do this. And we went to all the employers, if you remember. And it was IBM at that time. And we did a pro rata distribution. We used Steve Finkel of the Ulster County Economic to help us conduit the funds until we got nonprofit status, and the rest was history. We did it, and it became highly successful. We then developed a well care, and then it got big. We ended up with 7 different HMOs around the country, and so it was an interesting experience. But the most important was with Tom Roach, and who was the commissioner of social services at the time. Tom and I were county legislators.
Yeah, Tom was great.
He was a great guy.
I know that I remember particularly some of his discussions with his Republican colleagues.
Yes.
That Tom felt that you couldn't turn your backs on the poor.
Yes, exactly correct. So I went to him and I said, Tom, how come our poor people, I came from a poor family, you've been a champion of poor, shouldn't have the same health insurance as you and I?
Yeah.
He says they should. I go, well, let's allow the Medicaid recipients to have the option to come into WellCare and join. He goes, great. I go, but there's only a problem. Nobody's ever done it before. So we're going to have to help write the legislation for it. Good, let's get it done. The rest was history.
Yep.
And next thing we know, Tom and I are in Washington, D.C. before 5,000 people winning the National Public-Private Sector Award. It was a big deal. Little Ulster County, here we are. And so we showed it and it took off. Now it's mandatory that every Medicaid recipient must join an HMO. But it was an interesting run. I think that was about 16 years. And I was so proud of the culture that we developed. Mm-hmm. And I don't know exactly how many, but somewhere between 3,000 to 5,000 people worked at WellCare at some shape or form in their career. And it was just a wonderful experience that I will never have again. In fact, I think for many of the WellCare alumni, so to speak, they probably never had anything so beautiful. So it was a nice period of time, and it also allowed me to understand that these corporations can get big, and it becomes very big business. Mm-hmm. And the HMO industry shifted and pivoted to becoming insurance companies, not health plans. And so we go forward, and then I purchased Bienestar from WellCare, stayed on as chairman of WellCare, and then wanted to do more international stuff. So we set up the first HMO in Mexico. That was a very interesting project. and working in a system where 5% of their wealth goes to healthcare, and it's a national health system. So that was an interesting experience. Worked in Peru, worked in different places, had a big project in Florida learning about natural medicine, traveled all over. Always kept my home in Mount Tremper.
Yep.
Always back and forth, back and forth, back and forth. My wife stayed with me through all of this. Now we're going on 44 years. And so it's been a real adventure. You know, I go from chapter to chapter, adventure to adventure, but the heart of it has always been people.
Now, you're talking about, you have stepped away from perpetual increases in scale to more the idea of, if I may say, a perfect community, a community that handles its needs in an egalitarian and effective and loving way. And so that's a decision that you make.
It was a conscious decision.
It's like the difference between being, the owner of a supermarket chain and somebody who just tends his own garden.
Yeah. We all have that choice. Yeah. You made your
That's right,
choice.
Exactly.
And there's no right or wrong. You got to leave your ego at the door. When I do lectures, I go to people. When you're successful, be humble, but be proud. And when you hit bottom, don't take it so seriously. Just work yourself back up. And it's the same thing. You could be chairman, CEO of a large company, and that's a role. But you also can be pharmacist ed and feel the energy of the people and how they're glad to see you and you're glad to see them. And you can be there for it. I just had a gentleman just this last week, and he's from Lanesville. And he had been into pharmacy one other time, Getty, and he came in and he says, I just got discharged from the hospital, and his head was down. And I looked at it, I said, they're putting you on a very tough blood thinner, it's twice the dosage, so you don't get a blood clot. And I said, but your copay is $290. And he looks at me and he goes, I can't afford that, just send me home to die. And I said, no, we're going to take care of this. I have a patient assistance fund. We're okay. He goes, what about my pain medicine? I go, didn't come in yet. I'm stalling. I had my staff call up the hospital, where is his pain medicine or whatever. So anyway, he leaves. Half an hour later, he came, the script came, and I call him up, and at 6 o'clock, and nobody answers. So I had to stay late. I was there about 8:30. I go, I'm going to find his house in Lanesville. I got to be able to find it, Maybe he'll still be up. So I come back down, and I knock on the door, found it, and he's still in the back. He comes out of his office, and I'm holding up his bag, his pain medicine, And he saw my face, and I'm going, I'm not going to rob, here I am at it. So he goes, opens up, Getty, the face of joy.
Yeah.
You just, I go, hey, you got to sleep tonight. Make sure you take it with food so you don't get nauseous, a lot of water so you can get constipated, kind of cut in two because they didn't give you a lot, but hey, brother, this is what we do. I left and I went, whew, that's the model.
Okay, that's the model I have. Clearly, your allies are the remaining local pharmacies. So how do you work with, say, the Boyceville pharmacy and the Nikos pharmacies in order to prevent being swallowed by the big guys and to retain that sense of community service? I know when my wife called up the Boyceville pharmacy last, she turned and said to me, they asked how you were. They always ask me how you are. And I thought that's really a sense of community there.
Yeah. I think they've done a very, very good job. And when Marty Millman had the Phoenicia pharmacy, it's 5,000 square feet, and he closed, most of the business, I believe, all went to Boyceville for it. So that had to give them a little bit of a lift. What we're looking at is that the pharmacy component is going to be just one component of it. And so when we get done, the community of Phoenicia are going to own that health wellness center that's in the old Riccardella's restaurant. And we'll be planting the seeds for education, for mental health services, all the things that as we adapt. Now Brian Callahan's going in with primary care services that will allow for some more innovation and ways to connect. But our model it's much more comprehensive. It's much more than just the retail. And I'm not sure how many prescriptions that will be filled, and I'll be able to balance that out with the Tannersville operation. Mm-hmm. And I'm not sure of how many people would want to, or is not going to leave Boydsville to come. It's certainly not something that I would like to see. I hope that we can continue to have a very successful community pharmacy in Boydsville and a successful model wellness center in Phoenicia. But it's going to be they do different things. They're very, very different model.
That's really, I wish you an enormous amount of success. I think it does say something to your loyalty to the community and to your wife's strength of character. You've been doing this, staying on Miller Road for 44 years.
Yeah, I love it. Every day I'm always waiting to see if my eagle comes out, Uh-huh. And I saw my first coyote the other day in Chichester.
Okay.
Yeah.
Well, I've heard them more than once. Maybe it was the same guy.
No, it's a wonderful way. And what we got to be able to do is to really adapt to the change. So there's a migration up from New York. There's more second homes, right? The wellness center is their friend. Everyone's treated the same. Doesn't matter. And I will have relationship with county services and so on. And then I want to retire in 5 years and go, hey, we left behind something powerful that will be sustainable and permanent. And that's what I'm concerned about.
Well, I ended I think my last podcast or the one before that with a statement from, I believe, from Cromwell's time, the Glorious Revolution. There was these people, there were the levelers and the diggers and all kinds of people with ideas as to how the world should be organized. And there was I guess a Colonel Ireton who made a statement as this Putney debates, and that was, the poorest he hath as much right as the richest he.
Yes.
And I think I'll end this podcast with that same note, and it's one that will sustain. Thank you very much, Ed.
Thank you, Gary.